All right. Thank you so much for joining us on this Wednesday morning. Welcome to this month's Direct Care Workforce Collaborative. I'm Brooke Snyder, Workforce and Sustainability Specialist for Department of Healthcare Policy and Financing. And I get the pleasure of helping kind of facilitate these meetings along with our leadership team, which you'll get a chance to meet here in a little bit. So we're just super happy you can join us. We have a great agenda that we'll kind of hop into here in just a second. Just so you know, we are recording. So just avoid sharing any protected health information or anything you wouldn't like posted onto our website. We find that a lot of people like to go back and rewatch the recordings or watched if they weren't able to join us in real time. So just being cognizant of what you're sharing to the larger group, knowing it will be recorded and shared out. I have several team members here today that are helping me monitor the chat. So feel free to use the chat for questions, any feedback, anything like that that you'd like to share or ask questions, feel free to use that, and we'll make sure that it gets read out and answered in real time. You're welcome. Well, you're not welcome to. You can get the slides from the Direct Care Workforce Collaborative website. We'll send those out and post them to the website after the meeting itself. Usually takes about 5 to 7 days for us to get it through accessibility checks and get everything posted to the website, but the slides and the recording will be posted there once that's been kind of gone through some accessibility checks. So be sure to check that out and share with folks. If you're listening by phone, I'm not sure we have anybody, but just in case, press *6 to unmute your line at any time or *9 to raise your hand to participate, to ask questions. We welcome that as well. I have turned on closed captioning, and so you're able to kind of control that on your own on your Black Zoom toolbar. You can turn that on or off. And meeting information as well as information about our action groups, past meeting, recordings, slides, that can all be found on our Direct Care Workforce website, which I dropped in the chat there. That's where you can find schedule updates. You can find other links to some other stuff that we've done, the base wage, the Direct Care Spotlight, our public awareness campaign. Just a really great website to bookmark and continue to visit just as we kind of move through this work. All right. I'm going to do a quick attendance. Normally at this point, I would do polls too, but I found if I wait a little bit later in the meeting, more folks are able to join us and answer those polls so we get a little better idea of who's joining us. And so right now, I just kind of ask those that are in attendance to just drop in the chat your name, your location. Well, you don't have to put your location if you don't want to, but your role and title, kind of what brings you here today, the agency you're with, or if you're just kind of how you're connected to this work. And so we're going to get an idea of who's in the room with us, do some networking through the chat that way. All right, perfect. I see people are starting to do that. So just a quick overview of our agenda. Again, doing the welcome and attendance right now. We'll do polls a little bit later. We're going to have part of our Direct Care Workforce Collaborative Leadership Team do some quick updates and perhaps some some introductions and some updates. We're going to have Rachel from HICPUF do State of the Workforce Survey results. Really excited to share that back with you all. I know a lot of you are familiar with that or partaken in that, that survey. We have a few ARPA project updates that we'll provide to you. Deborah Lively, our Direct Care Workforce Collaborative co-chair, will be giving us a legislative review and overview. Jazz from the HICPUF team will be doing a base wage update that I neglected to put on the slide, but he's here and he's going to do that. Then we'll have a Direct Care Workforce Collaborative, Direct Care Workforce Stabilization Board update from Carrie Chesney with CDLE. We'll have time to do an open forum for questions, for you to share announcements, basically to just get us all connected on what's happening in your world. And then we'll do some resources and closing in survey. So that's just a quick overview of what we have going on. I see folks are continuing to put stuff in the chat just about who they are and where they're from, which is great. Thank you so much. Lots of familiar faces. And at this point, I think I will turn it over to Oliver to really meet the leadership team and take us through the next couple slides. Thanks, Oliver.
Great, thanks, Brooke. My name's Oliver Giminero. I'm one of the co-chairs of the Direct Care Workforce Collaborative, along with Penny Whitney. She is not with us right now. I have a background in mechanical engineering. I've been doing advocacy work for the last 8 years or so. I've been living with a spinal cord injury for the last 33 years, C4 quadriplegic. So direct care workers are a big part of my life, and I'm just grateful for what they do. Now I'm going to introduce you some of our other co-chairs, and those do a brief introduction and any updates about their action group. I think I saw Brooklyn. Are you here, Brooklyn? You do a little brief introduction.
I am. Thank you, Oliver. Hi, everyone. My name is Brooklyn Reel. I work for Aerial Clinical Services. I'm their HR generalist for the Front Range. We serve adults with disabilities. We started out as a foster care agency. I've been with Aerial for just over 7 years now, and we have a lot of direct care workers in our agency, ranging from DSPs and host home providers. And a lot of the work, I spend a lot of time with them, so I know a lot of the work that they do and how much value that they bring to Colorado and the individuals that we serve. So, welcome, and so glad to have you. And my co-chair in the Value and Awareness Action Group, Pascal. I'm not sure, is she here with us? She's also co-chair in Value and Awareness.
Awesome. Thank you, Brooklyn. I don't see Pascal with us.
Okay.
So we'll go to Deborah. If I'm not Deborah here. So if you do a brief introduction, thank you, Deborah.
Sure. Hi, I'm Deborah Lively. I'm Director of Public Policy and Public Affairs for Leading Age Colorado. We're a statewide trade association. We represent the continuum of senior living and aging service providers. And I'm the co-chair of the Compensation and Benefits Action Group. And we're really focused on how we can better compensate our direct care workers for the services they provide, and improving the benefits that they also receive. At our last meeting in May, we heard about the base wage increase for Medicaid HCBS providers. We got an overview of some federal rules that are going to be impacting wages provided to our direct care workers in certain service lines. And then also we talked about the dashboard. HICPUF provided an overview of the direct care worker dashboard, and learned that in Colorado, the average wage is about $18.66 an hour for our direct care workers. So thank you.
Awesome. Thank you. And thanks for those updates. I think that's exciting stuff. And I don't see Bobby or Ashley. Am I missing you, or are there a different name?
I think Ashley has joined us.
Oh, awesome. Yeah, Ashley, if you just do a brief, oh, I see you there. Sorry. If you just do a little brief introduction about what you do, and then if you have any updates for our well,
Yes,
you're chair. I'm confused. I'm sorry. You're a co-chair with Deborah.
Yes, I co-chair with Deborah. I am a recipient of CDOS and have been working with direct care workers for over 20 years. And as Deborah said, we're just trying to make sure that they have a living wage. And so I work with her with compensation and benefits, and look forward to seeing what we can do with all of this information that was just provided at the last meeting.
Awesome. Thank you. Am I missing Bobby?
I do not see that she has joined us, Oliver.
Awesome. Well, she's a co-chair of our training and career advancement action group, and she's got great experience in the job field. So we're excited to have her with us. And we're actively seeking another co-chair for the training and career advancement. So if there's anybody that might be interested, it's really not a lot of heavy lifting. It's pretty neat, good group of people. You meet monthly for leadership meetings, and by every other month for a action group meeting. So it's not a heavy lifting, and it's good work. So if anybody be interested, please reach out to Brooke. Next slide, please.
Yeah, one comment, Oliver. I apologize. You can reach out to me, but that is the wrong email address on the slide. So I'll update that before I send the slides out. But I'm also putting the correct email address in the chat. I just forgot like half of it. And so I'll update that and make sure that goes out. So yeah, if you're interested, let me know. All right, Oliver.
Great, thank you. You know, these are probably a little backwards, but anyways, I'd like to welcome you to our training and career advancement meeting. We meet every 3 months, and we're made up of action groups. 3 action groups and they're like the pillars of the support that supports the direct care workforce collaborative. And those 3 action groups are training and career advancement. We really want our direct care workers to have knowledge about career options and different directions they can take in the direct care workforce. Compensation and benefits, we think that's really huge in attracting and retaining direct care workers. And then value and awareness. If there's no value, I'm sorry. If there's no value or awareness of what our direct care workers do, then it's kind of hard for compensation and benefits. And the collaborative is dedicated to advancing the public's general awareness of the direct care workforce. And we advocate for those 3 pillars that we just talked about. Compensation and benefit, career training and career advancement, and the value and awareness of our direct care workforce. And we envision a Colorado where consumers can receive high quality support and care from a strong workforce of skilled, qualified direct care workers who are well compensated, well trained, well respected, and have value in their workforce. And yeah, I'll send it back to you, Brooke.
Perfect. And we are lucky. It looks like Bobby has joined us. And so Bobby, we missed you on the leadership introduction. If you wouldn't mind coming off mute and telling us a little bit about yourself as a co-chair.
Hi, everybody. My name is Bobby Christensen. I am the new co-chair. I took over for a lovely friend of mine by the name of Jen Oakes. So I am still trying to get my feet wet. I would love to get feedback from all of you as to how we can work together. My personal goal is to use my connections as well as my training as an advocate and a disabled person who uses benefits myself to help spread the word and help find new avenues to reach people that need attendance, as well as help attendants get better compensation at the same time.
Perfect. Thank you, Bobby. And if you're listening to Bobby and you're like, oh my gosh, that sounds so exciting. That's the co-chair position we are trying to fill is Bobby's co-chair. And so you get a chance to work with her and her great experience. So looking forward to connecting with folks that are interested. All right. So I think we've kind of settled in terms of folks joining the meeting. So I'm going to go ahead and kick off some polls before we go into our first agenda item and presenter. And so let me get them pulled up here for us. So the first one is really about which region you represent and where you're joining us from today. I'll give folks 20 seconds or so to file in and complete that. And then I'll share the results. All right, that looks like everybody. So let me share here. So we are missing a few regions. And we see this kind of in our action groups as well. We have had meetings where all regions have been represented by 1 or 2 folks in like the Western Slope and also the Southwest region of our state. And so we're really going to start. The leadership team has kind of been doing some revamping, looking at what we're doing, and really wanting to do some outreach and bring some new folks to the table, including our direct care workers. And so I think this gives us a good place to level set and say, hey, we really need to do some outreach to these folks in these other areas. So if you know of anyone in these areas who you'd like to bring to the meeting or share with them, we'd love to have them, but also know that we're going to be doing some outreach on our own as well to try to get those regions represented so they can partake as well. All right, so let me go to the second one here. And this is how you identify on the direct care continuum how you're connected to the work. All right, and that has stabilized. So I'm going to go ahead and end this and share our results as well. So we do have a couple members joining us today and family members of members. We're always well represented by our employers, our advocates, our government agencies. And if you are one of the 8 people that's selected other, I'd love to know kind of how you identify on the continuum. Maybe we can put a different poll option on there to capture most of you. And I see that we don't have any direct care workers. We understand this is a difficult time for most direct care workers to join us. And so again, the leadership team has really been brainstorming some ways to get some different engagement. And so you may see some, discussion around being flexible in our times or allowing for more workers to join us as well so their voice is heard. So just kind of keeping that in mind, that will certainly message all that and stuff, and the leadership team can come and talk to you about that. But we are hoping to get just some different engagement and keeping them at kind of the forefront of what we're doing as workers. All right, last but not least, I apparently don't know how to operate this. There we go. I had to stop sharing the first one so I could launch the second one. Perfect. So the third one is how you heard about us. We'd love to know how you got connected with us and got us here in front of us. All right, that has stabilized. Let me share the results here. We appreciate our advocates and our employers. We know that they're the ones that are sharing a lot of this information out for us, sharing these opportunities. So thank you, appreciate you. We also know that a lot of our folks are learning about these opportunities through a HICPUF communication, most of which is constant contact, and that comes out from John Barry twice a week. That includes updates from the Office of Community Living, different stakeholder engagements, not just for our meetings, but for all meetings across OCL. So if you're not connected with that, but you would like to be, I'll drop the sign up for the email newsletter in the chat there. It's a great way just to keep in touch. If there's meeting changes and that kind of stuff, he shares those announcements for us. And again, just gets you connected to work outside of what we're doing as well, if that's something you're interested in. All right. Thank you for letting me do those a little later in the meeting. I appreciate it. And with that, I think I'd love to kick it off to our first presenter, Rachel, if you're with us.
I am here. Hey everyone, my name is Rachel Newton. I'm sure some of you have seen me before, so thank you for having me join you again today. Today I will be sharing with you results from the 2022 State of the Workforce Survey, but we'll also be looking at data across the years and do a little bit of a comparative analysis. Next slide, please. Great. So this survey interviewed agencies that provide services to adults with intellectual and developmental disabilities. The survey defined direct care workers as workers whose primary job responsibility is to provide support, help with skills development, guidance, or personal assistance at any location during any activity. So this could have been at home, leisure activities, at work, during recreational activities, etc. States were also allowed to include paid staff members who spend at least 50% of their hours doing direct service tasks. So they may also do some supervisory tasks, but their primary job responsibility must be direct care work. And more than half of their working hours are spent providing direct support. It also collected data on full-time and part-time direct care workers. Next slide, please. Okay, so in the survey, direct care workers did not include clinically licensed staff, so therapists, nurses, social workers, psychologists, etc. It also didn't include behavior specialists, behavior technicians, or behavior clinicians. Those who provide only transportation, home modifications, and/or meal delivery. It also didn't include contract workers, on-call or as-needed workers, staff hired through a temporary personnel agency, or admin staff or supervisory staff, unless, again, they spent 50% or more of their time doing the direct care work. Next slide, please. Sorry, is it?
I have it on the survey sample.
Oh, yeah, sorry.
Oh, no, you're fine. I was like, oh, no.
No, it's not USC. Okay, so Colorado survey sample. So based on those survey parameters set by NCI, we kind of choose our sample. So in Colorado, we serve agencies that provide services to members enrolled on the developmental disability and supported living services waivers. We also looked at agencies specifically who provide services for day habilitation, residential respite, homemaker, personal care, pre-vocational services, life skills training, mentorship, peer mentorship, and support, and/or supported employment services. So those were kind of the agencies that we were looking at. Next slide, please. Okay. So while the department is mandated to participate in the survey annually, agencies are not required to complete the survey. So we always have the goal to hit a plus or minus 5% margin of error to ensure the data is statistically valid. So the smaller the margin of error, the more we can ensure that the data represents the whole populations of the agencies that are being surveyed. Taking a look at our response rates across the survey years, while we get close some years, we do not ever hit a 5% margin of error. So just keep that in mind while we continue to look at the data. Next slide, please. Okay, so most direct care workers in Colorado are reported to be white, though this has been decreasing since 2020. In 2022, agencies reported 14.8% of the workforce was Hispanic or Latinx, 2.4% was Asian, 40.1% were white, and 15.1% were Black or African American. Next slide, please. In Colorado, more than half of the direct care workers are women. In 2022, agencies reported 67% of the workforce was female, 23% was male, 9.7% didn't know the gender identity, and 0.1% reported non-conforming or non-binary. Next slide, please. So the agency size, most agencies employ between 1 to 40 direct care workers. So Colorado agencies typically tend to be smaller, employing fewer direct care workers when we compare that to nationwide. There appears to have been a decline in the number of direct care workers employed by agencies since 2020. And additionally, in 2022, 53.4% of 53.4% of agencies reported either rejecting new service referrals or halting their acceptance due to staffing constraints. Next slide, please. So similarly, Colorado agencies typically cater to a smaller number of enrolled waiver members. In 2022, over half, about 63.4% of agencies in Colorado serve between 0 to 50 adults. Next slide, please. So looking at agency service types, in 2022, 53.9% of agencies provided residential support. So this could be community-based group homes, supported living services, or ICF IDD homes. So since 2018, there has been a decline in agencies offering residential supports to members, with a notable increase there in 2020. Next slide, please. In 2022, 90.4% of agencies provided non-residential support. So this is day supports, community support programs, community-based employment supports, facility-based employment supports, or out-of-home habilitation. Most agencies in Colorado provide services outside the home, and the numbers of agencies offering these services has typically, as you can see there, straight across, remained consistent over the years. Next slide, please. Okay, so in 2022, 60.9% of agencies provided in-home support. So this is homemaker, personal care, in-home habilitation or respite. This looks to fluctuate from year to year, but if you look at those numbers, we basically remain a little over half of our agencies providing this service. Next slide, please. Okay, looking at turnover ratios. In 2022, Colorado's turnover rate was 42.6%. Our trend line reveals a gradual reduction to Colorado's overall turnover ratio. However, in 2022, we were ranked number 4 in the top 5 states with the highest turnover ratio out of 18 states and Washington, D.C. Nationally, the survey has also been tracking an overall downward trend in the DCW turnover ratio as well since 2018. Next slide, please. Okay, so for tenure among employed direct care workers, Colorado has remained similar to the NCI weighted average. However, direct care workers tend to reach that 36 plus month tenure at a higher rate than we do nationally. Of the DCWs employed by agencies, on average, about 1/3 had been employed there for a year or less. Next slide, please. And then looking at tenure among separated direct care workers, again, this is looking at length of employment. Of the direct care workers who left employment at responding agencies during the surveyed year, about half of direct care workers had been employing at the agency or had been employed at the agency for 1 year or less. So Colorado has kind of remained comparable to the NCI weighted average across the years. Next slide, please. Okay, so this is among responding provider agencies in Colorado who do distinguish between full-time and part-time direct care worker positions. The vacancy rate for full-time positions ranged from 6.4% at the lowest in 2019 to 17.1% at the highest in 2022. So Colorado was under the NCI weighted average until 2021. However, Colorado's full-time vacancy rate has been increasing since 2019. And then in 2022, Colorado's full-time vacancy rate passed the national average. And then looking at the vacancy rates reported for part-time positions, again, that range from 2.4% at the lowest in 2020 to 13.6% at the highest in 2021 and 2022. So Colorado's part-time direct care worker vacancy rate, as you can see, kind of has remained under the national average. However, the part-time vacancy rate has been increasing since 2020. And so we can kind of see that incline spanning across the 5-year reporting period on that graph. Next slide, please. Okay, so average hourly wage in Colorado across all the service types. So this was looking at all those service types that we talked about: residential, out of home, and in home. Participating agencies recorded a rise of $3.72 in the average hourly wage. So we climbed from $14.59 in 2018 to $18.31 in 2022. And so in this area, we continue to be above the national average for hourly wages, which is great. Next slide, please. Paid sick time. So there also has been, a growth in agencies offering sick time from 59.3% in 2018 to 79.5% in 2022. We were previously below the national average, but we surpassed in 2021. Next slide, please. We also looked at paid vacation time. So our trend line does show a minor decline in agencies offering this benefit over the course of the 5-year period. Typically, we lag behind the national average in terms of agencies that provide that paid vacation time. Next slide, please. Throughout the reporting years in Colorado, the proportion of agencies offering paid personal time expanded from 39.7% in 2018 to 45.8% in 2021. So we kind of fluctuate between being above or below the national average. So we're kind of, fighting there. Next slide, please. Okay, so kind of looking at additional benefits, we kind of had a consistent level of agencies offering health insurance, with approximately half providing this benefit. In 2022, 57.3% of agencies offered health insurance to some or all of their direct care workers. 50% of agencies offered dental coverage, 42% offered vision coverage, and 44.6% offered an employer-sponsored retirement plan. And so if you notice, this also says to some or all direct care workers. The full report does keep track of when direct care workers do get paid. Do they have to be full-time? Do they have to work there for a certain amount of time? So if you're interested in that kind of information, next slide, please. You can go and look at some of our reports. So future survey cycles, we are planning to continue administering both those surveys, the IBD, and we also are adding the aging and disabled survey to our surveys. Again, I mentioned that was mandated, so there's a link to that bill if you want to see why we are participating in this survey. We do have the State of the Workforce Intellectual and Developmental Disability Survey going on right now. It launched in March 2024, so we're collecting data from 2023. That data collection is set to close on June 30th. We do have that, again, like I mentioned, that full national survey report. You can click the link here. If you don't want to look at the full report, but you just kind of want to see a snapshot, we do also have a state at a glance report that kind of just goes over things pretty quickly. And then also there's a link to our website if you're interested in seeing what other type of surveys or any other reports that we have available. State of the Workforce, Aging and Disabilities. I'm not sure when this one is going to be launching yet to collect the data from 2023. I think right now they're saying maybe August, September. But we do have the 2022 survey national report available. And if you want to find out more information about that survey, how it's different from the IDD, I also put nciad.org's website on here, so you can go to their website and read some more information. Next slide, please. Is there any questions about the information? If I don't know the answer today, you can email me.
And you're welcome to use the chat or raise your hand if you have questions for Rachel. I took a look, Rachel, at the Colorado's at a glance, and that's great. Like, it's a great way to not have to comb through just pages and pages and pages. So I second that. If you're not wanting to read the whole thing, click on that at a glance over there.
Like, Rachel's enough. She was so boring. We don't want to read that whole
No.
report. No, I was kidding. No, if you're feeling that way, the at a glance is pretty cool. So I suggest you guys checking that out. I also think we have up there a comparison of the IDD and AD, so you can kind of take a look how those results from 2022 comparatively for those populations. So that's also pretty cool too. Next slide, please. And there is my contact information. So if you think of a question or you're interested in learning some more information, please feel free to reach out.
Perfect. I'm going to just drop it in the chat really fast. But again, we'll have these slides sent out too in the next little bit, but just in case you have a burning question for Rachel. Heather, please.
Rachel, is there any potential for NCI to combine the AD and the IDD just in future surveys?
You know, actually, because I also sit on some of those survey meetings to kind of hear about like the future of the surveys. And I know that's definitely something that different states have approached them about, just because, you know, here in Colorado, we do have a lot of agencies that overlap. So, you know, they might provide services to a whole bunch of waivers. So then we're asking them, hey, can you fill out this survey, you know, 2 times a year? I think they kind of mentioned, I forget what the reason was as to why they don't, but they kind of, I can't remember, but they did talk about possibly looking at doing something in the future, but there was something they had to sort out. I think it had something to do with the different ways they collect the information and the different types of whatever, and trying to figure out how to differentiate that data, because sometimes the waivers pay at different rates and they didn't want it to skew like the data that they were collecting.
Well, lucky for us, we have the access rule and the 6-year window to hopefully be able to explore this. Thank you very much. Appreciate it.
Thanks, Rachel.
Thanks
Any
again,
last
guys.
minute?
Oh, sorry, I was just saying bye. Bye,
You're
guys.
like, bye. Yeah, you're like, let me go, Brooke.
No, you can talk to me if you want, Brooke.
Well, thank you, Rachel. Thank you so much. Last call for questions before we let her off the hook. Perfect. Thank you. And Rachel, I appreciate you. And I know that this is great information, especially as folks really dig into it, and appreciate you being available for questions as that kind of comes up. And lots of discussion that we've had in our action group. So appreciate you joining us.
Thank you. Thanks for having me.
All right, perfect. Well, let's move into our next agenda item. We're going to do some ARPA project updates from the workforce team. And so I believe John is up first. John, if you wouldn't mind just introducing yourself quickly and then take it off.
Good. Thanks, Brooke. Good morning, everyone. My name is John Hendricks. I'm the Direct Care Workforce Support Specialist, and I am working on the ARPA 1.04, which is the Resource and Job Hub, or directcarecareers.com. So Direct Care Careers, for any of you who don't know or are new, is sort of a comprehensive online resource and job hub for direct care workers and direct care agencies. It's sort of split into well, not split, but I think of it in two ways. Like part of it is sort of like Indeed, where employers can come and post jobs and candidates can come and post resumes. And our site is unique because we have an auto matching feature, which if there is a job posting that is in the area and has the same qualifications as a resume, it'll automatically connect those two. So it will automatically show up on the page for the employer that there's a candidate out there that has experience that is close to what the job application is. And also conversely, if someone goes on and posts a resume, it'll automatically connect them with job postings out there that match their skills. So that's the Indeed part. And then there's sort of like the LinkedIn part where we have resources, we have training modules that are going to be coming up here. We're just putting the finishing touches on a lot of those right now, and those should be posted here in the near future. We have resources. As you can see on the slide, we have 399 resources, and these include different types of training for direct care workers, like HIPAA is the big one on there. But it also goes into resources that a direct care worker might need, like childcare, insurance, things of that nature. And also it has resources for employers as well, kind of working with communities and nonprofits and grant writing and things of that nature are all in the resources section as well. And as you can see here, it is growing. We have a total of 185 direct care workers who have signed up for the site. We have 45 active employers with 31 job posts right now. But today, I'm going to drop a bunch of links in right now for you all. So the first one is for the site. If you click that, you'll be taken to the same picture on the slide here. We also have demonstrations for providers and applicants. These are basically like, if you're a provider, it just kind of walks you through how to sign up for the site. Same for the applicants. But really today, what I'm here to talk about is CDOS and CDOS employers. So I know a few of you have been waiting a while for this. We are going to start our beta testing for that. And what we're going to do is I have a CDOS sign-up form that I dropped in the link. If any of you are CDOS employers and you're interested in trying to help us, you don't necessarily even have to like be in the market for hiring someone, but that would be great if you are. What we're looking for are just folks who can come in, look at the site, make sure it's what, community direct or consumer direct folks need or even want in the site, and just kind of look it over, make sure that there are no issues that you see or anything like that. Like when we were developing it, we kind of had our wires crossed with another state and they were putting in the wrong sort of language, but we got all that sorted out. So it was like they were putting in CDS instead of CDOS. So it's like some of those little things, but mainly we want to make sure that it's user friendly and that it's easy to understand. And if you have any suggestions to make it better. So if you're interested in that, you can go to the sign up form. It's really quick and easy. There's 4 questions. It's basically your name, your email address, your number, and what waiver you're under. And once I get that, in a week or two, I will then send out a doodle poll to set up trainings with you all. And then we will all kind of get together in a training room and I'll kind of walk you through how to log in and kind of walk you through the process. It looks like Oliver has a question. Oliver.
Yeah, I'm beating the drum. I appreciate and thanks for all the hard work. I tried to go onto the CDOS link, the sign up form, and it said I don't have permission. So I don't know if other people are running into that, but I wasn't. It kind of blocked me out.
Yeah, I just probably didn't set it up for everyone to have permission to do it. So let me get that fixed, and I'll we'll get you in there.
Thank you very much.
Yeah, I'm sorry about that. Are there any other questions?
Looks like Ashley had a question in the chat that Heather was able to answer, but Ashley was wondering if it cost anything to join, and Heather was able to tell her, no, absolutely free.
Yeah, no, totally free. Like I said, we do have a pre-approved provider list for all agencies because they have to be home community-based service provider waiver providers. So if you're not, you can't get into it, and that goes for CDOS as well. Right now, if any of the CDOS folks try and get logged in, you won't be able to access it under your FMS number that you would need to put in there, because I have to go in and put that information in. And so we're going to do that on for each and every person who shows interest and wants to sign up, so your information is not logged in there. So we'll do that once we get our training together and we kind of walk through how to get on the site and how to use it, and kind of just discuss what we might need.
Perfect. I was gonna shoot you a question, but it looks like you answered it through your discussion. So
Perfect.
Good to go.
Awesome. Yeah. Oh, please go ahead.
Yeah, there's a question there I just want to call out. Will this replace the CDOS website? I'm assuming the job matching website. I'm not sure. iPhone 2. If you wouldn't mind, if you can come off mute just to give us a little bit of feedback so we can make sure we answer your question, we'd love that. The job site.
I see Jessica is on. Maybe Jessica, that's something that you are able to answer.
Yeah, and this is Lisa. Can you hear me?
Yes, we can, Lisa.
Yes, yeah. Thanks for taking my question. Yeah, we were. So I was just curious if this is going to replace the CDOS worker directory, if that's going to be going away and it's all going to be funneled into the directcarecareers.com website.
Perfect. Yes, please, Jessica. I think Jessica can get us where we need, Lisa.
Okay, thank you.
Hi, everyone. Jessica Corral here. I'm the contract specialist for participant-directed programs. So we manage CDOS and IHSS. Thank you for your question. It will not replace the CDOS attendant directory. We might do some work to see how we can streamline the two of them to make sure there isn't any confusion or redundancies, but that will not go away. And for those of you not familiar with it, it's a attendant directory specific to CDOS that is hosted by Consumer Direct for Colorado. This is the training vendor that supports CDOS and IHSS members with training and resources. So I'd be happy to put the link to that directory in the chat so people can take a look. But thank you for your question.
Could I ask just make a quick comment? And I'll let you know a little bit more about kind of why I called in. But a few days ago, I had a friend try and reach out to Adam Markert, I guess, who heads up the directory. And she didn't receive any calls, and she had received, actually left a few messages. But the directory just doesn't have, there's not a whole lot of interaction there, and there are not a lot of individuals listed that are looking for employment. So just kind of a comment. And that's a reason why I was wondering if it was funneled into your site, because the CDOS directory just didn't, I don't know, it seems to be kind of dwindling, I guess, for lack of better words. So.
Yeah, thanks for your feedback. We always welcome feedback. A couple of things. Adam Markert is no longer with CDCO. So those of you who are familiar working with him, jot that down. I can also put the contact information for the best person to reach out to now. And then, yes, it does rely upon people like revalidating their interest in being in the directory. And so if people don't do that, it does deactivate those accounts after a certain period of time. So we're always looking for ways to get people's confirmation that they want to continue being in it, and then also sharing through a few different avenues that it even exists so people can sign up if they want to. If you have ideas on how we can maybe do that better, I'd love to hear them. So thank you again.
Thank you.
Thank you, Jessica. And yes, please drop any relevant links you think might be helpful in the chat, and we'll make sure those get captured for the recording as well. Thanks, Lisa. John, back to you.
Great, thanks. And Oliver, I think I've corrected the issue. I'll drop the link again. So, and please, if any of you know anyone who is a CDOS employer who might be interested, who is not here today, please feel free to share the sign-up form with them, and we'll be reaching out. Oliver, did you have a question?
Yeah, so I filled it out, and then when I go to send the information in, it asks for the respondent's email or whose email address to send it to.
Oh, you would just put your own email address in there, and once you hit send, it should come directly to me, and I'll be able to compile everything.
Because when I hit send, it pulls up a thing. It says send form to.
Oh,
enter names or email address and subject CDOS sign up for direct care workers.
I think it's the wrong access. I was looking at it
is.
too.
Yeah, I'm
Yeah.
sorry. I really mucked that one up. I'm sorry.
Stay tuned, Oliver. Stay tuned.
Oh, you're good. I'm trying
We'll
to.
get it to you. When everyone else is speaking.
I'm testing in real time. Yeah.
Yeah, I think I sent you the one that I did, not the. Yeah, I see what I did. I'll get you the right one. Apologies.
Perfect. Thanks, John. Appreciate that. Any other questions for John while he kind of works on the back end to get the access updated for us? Perfect. And maybe we'll check back in an open forum, just make sure everybody's able to get where they need to go with that. Well, thank you, John. Really excited to continue to get these updates and share with you all. A lot of work's got into it, so super pumped to have it. Thanks, John. All right, I'll take us into our next ARPA update and kick it over to Justin.
Hello, hi. My name is Justin Melton. I am the Direct Care Workforce Training Fund Administrator for the ARPA 1.05 grant. And I don't have a lot to talk about because ARPA is winding down. It's the last few months, but I do want to do one more plug for the ARPA 1.05 individual grant. So the individual grant is a reimbursement-based grant of up to $500 for HCBS and direct care workers, including home health aides and CNAs. These trainings have to be higher level, specifically to help direct care workers advance within their careers, and cannot supplant existing onboarding and annual trainings, such as CPR, first aid, safety care, and QMAP training. So yeah, if it's something that should already be provided, we generally cannot cover it. We also made some changes to how the application process works. Previously, an individual applying would have to apply 60 days prior to training in order for us to process the award. Now it's more like 20. It's like a 20-day window. So we can get people to the trainings a lot faster. We were running into an issue where people wanted to go to a training and couldn't actually get there because of the processing time that it took our fiscal intermediary public consulting group, which is PCG for short, to process the whole thing. And we figured out a way to do it shorter. All applications for this grant close on July 15th. So there's still time to get applications in. And this grant ends at the same time as the provider grant, which is August 30th. So application window will close on July 15th. And your grant must be completed by August 30th. And that includes like all spending, all training. We've had a lot of questions where people will want to purchase a training like late August that continues into September, and we wouldn't be able to fund it. It would have to end by August 30th. So that's one hurdle that I would say look out for. Another one is just to be sure it matches the criteria. And I believe it looks like Brooke has dropped a link in the chat. The link takes you to the provider one. And if you scroll above, you will be able to get to the individual grant. And yeah, if there are any individuals, direct care workers who have hopped on, feel free to take advantage of this opportunity. It's great. We have lots of money to still throw at it. If you know direct care workers who are interested, please let them know. We want to get as much money into the hands of direct care workers as humanly possible so they can take advantage of these very cool training opportunities. If you have any questions, please let me know.
Perfect. Justin, do you want to, actually, I can do it. I was just going to drop the workforce email in the chat. So if there's any questions
yes.
about it, happy to field those for you and walk through that application process.
Sorry, I forgot about the email. If you have any questions about the application process, grant eligibility criteria, anything like that, feel free to contact us. Please contact us at this email. And we generally respond pretty quickly. Turnaround's about 2 days, but it's usually a lot faster because we want to get this money out. Yeah. Wonderful. And that's all. Thank you.
Thank you. Any questions for Justin? Perfect. Most of your questions could probably be answered on the website. But again, if you have any, just let us know. Justin's great and just kind of navigating the grants and the applications and really is just trying to get folks some good training.
Yeah, there's FAQs on the website that you can look at and read about all the grants. I'd say click everything. There's so much information there, and that'll inform you as to what you can and cannot do and apply for.
Awesome, thank you. And I do just want to take it back and capture one question Lauren had about Direct Care Career Center or the directcarecareers.com becoming the new home for direct care training modules. That's CDCT, that's the standardized core curriculum, which is ARPA 1.03. And yes, those are the training modules that will hopefully be loaded and available a little bit later this summer for direct care workers to use as training. That'll be where they will live, is on that site that John was talking about. So just wanted to make sure that we got that pointed out. Awesome. Okay, perfect. One final ARPA update for us. This might be repeat for a couple of you that joined the Compensation and Benefits Action Group or who were part of that, but we have ARPA 1.09, which is a workforce compensation report. This is where we hired a vendor to come in and look at innovative strategies to provide different types of compensation and benefits to direct care workers. We took this to the Compensation and Benefits Action Group, really got some feedback around peer mentoring, tiered compensation, just some really innovative ideas outside of just a wage that we could kind of employ or look at doing as a state. So some recommendations and stuff. So that report has been completed and has been posted on our website. Again, if you were part of Compensation and Benefits, you're familiar with that, you're able to provide feedback on that, but if not, and you're interested, it is live. It is right there. I believe at the upcoming Compensation and Benefits Action Group in July, we are hoping to kind of dig into this a little bit more and take a look at it with folks since they were instrumental in putting it together and providing feedback, and then really just digging into the report to see if there's anything we can take out of it as a group. So if you're interested in that, join us. I believe July 19th will be our next Compensation and Benefits group meeting. All right, let me just check the cat. Oh, I see a few folks. Actually, this is great timing because I know a few folks do have to leave us for an 11 o'clock meeting. And so one thing I just wanted to catch you before you leave is we do have a survey and a topic request form both that I wanted to put out to you all. Because it is important. We do read the surveys, we do take the feedback, we do try to incorporate the things that we hear from them. And so I'm just gonna send the survey link out just while we have your attention, and also the topic request form. And so if you have topics you'd like to see at future meetings or any feedback you wanna give us, these are the two avenues to do it. And I'll just make sure that I catch the folks that have to leave us at 11. But don't worry, I'll share it again a little bit later if you're going to stay with us the whole time. So just know that it is super valuable feedback. We take it to the leadership team. We go through and figure out how we can address each one. It's really important for us to be able to make this relevant and a good use of your time. So appreciate you, taking time to fill that out for us. All right, perfect. It looks like we're just a few minutes ahead of schedule, which is perfect. And so at this point, I would love to have Deborah Lively join us again to give us just a quick legislative review. Deborah, please.
All right, thanks, Brooke. I appreciate it. I just wanted to just give you an update on some bills considered by the legislature this year that really impact our direct care workers. First, of course, is the direct care Worker Appreciation Week that the Direct Care Workforce Collaborative had worked on for the past few years. We were able to get that passed. It was House Joint Resolution 1022. It was sponsored by Representative Mary Young, Representative Monica Duran, Senators Jesse Danielson, and Tony Exum. And the resolution named April 7th through April 13th of this year as Direct Care Worker Appreciation Week. And most importantly, it names the first full week of April every year going forward as Direct Care Worker Appreciation Week. We had several direct care workers that were able to attend the House session when it was considered. They were recognized on the floor. They had the opportunity to meet and talk with Senator Danielson. And so it was a really nice day for those workers to be able to be there and get recognized. And it really just allows us moving forward, all of us collaboratively, to know that every week or every first week in April is going to be Direct Care Worker Appreciation Week, and we can plan some events and recognition of those workers during that time. I wanted to mention House Bill 241312 by Senator Bridges and Rodriguez and Representatives Sirota and Garcia. And it offers a refundable income tax credit for direct care workers and also for childcare workers. For tax years 2025 to 2028, it creates a state income tax credit for any child care worker or direct care worker earning $75,000 or less. Unfortunately, CNAs are not eligible, and the direct care worker must have provided home and community services or worked at a licensed nursing home or home health agency for at least 1,200 hours in the relevant tax year. The tax credit is equal to $1,200, and it is fully refundable. The bill also requires HCPF to provide information on long-term care employers to the Department of Revenue, and then long-term care employers are also required to report information on their direct care workers to the Department of Revenue. The legislature also passed Senate Bill 24167. And it allows for portability of training for certain areas for direct care workers who are employed by assisted living residences. It requires the assisted living residents to provide a certificate of completion to an employee if they've completed training in certain topics. And then the employee may take that and present that certificate to another assisted living employer. And that new assisted living can take that and either do some competency testing or just trust that that training was completed, or they can also require them to complete the training with the new employer. But that's a good thing to be able for some of our direct care workers to be able to go from one setting to another more easily. And then lastly, I just wanted to mention House Bill 241066, which was a bill that would have required healthcare facilities to develop and maintain workplace violence prevention programs. And unfortunately, this bill did not pass. It made it through committee in the House, but then it kind of got stuck in appropriations and wasn't funded. So that one did not pass. So I know that was a pretty quick, I know I have 10 minutes on the agenda, and I know that was a pretty quick update, but if anybody has any questions, please let me know.
Perfect. Thank you, Deborah. And I snuck in a second piece for our team to update on the base wage. So the whole 10 minutes isn't even yours. So it's perfect.
Okay.
Let me just make sure there aren't any questions. I did drop the links to the bill language and history in the chat for you, and we'll make sure those are linked as well. Looks like Melissa has a comment. I'm just going to read it out loud, Melissa, just so it's captured on the recording. But I want to lift up the care workers who showed up to testify for the tax credit, the ones who raised the issue with Rep. Byrd on the JBC that poverty wages in a predominantly female industry is especially dangerous when it comes to experiences with domestic violence. Low wages mean no money to leave. It flipped Byrd and she became supportive. So their voices and the voices of those who need care have been making changes. So we appreciate that, Melissa. Just some insight into those who were able to testify for that. Really excited to be able to track that bill as it comes out and that tax credit for folks. And we'll kind of keep a pulse on it. I know Deborah and Ashley are great about keeping a pulse on those kind of compensation and benefits things for the action group. So I'm excited to keep that information at the forefront for us. So thank you for that comment. Looks like the CDOS sign up form link has been fixed, I guess. So I think it's ready to go for that. Let me just make sure there's no raised hands, no chats. Perfect. Well, thank you so much, Deborah. We appreciate you. We appreciate all the time you spend at the Capitol so you can bring us these wonderful updates. And we look forward to just kind of keeping track of them as they roll out. So thanks.
Thank you.
All right. Well, let's get a base wage update then. Jazz, are you with us?
Yeah, I'm right here.
Perfect. Sounds good. Take it away.
Beautiful. Okay, but by the way, if there's any sound or any issues with being able to hear me, please let me know. I'll be happy to repeat or go back to in case anybody missed anything. But for with respect to the base wage and the HCBS rates, essentially what we have here is a 2% across the board rate increase and specific targeted rate increases for primary services provided across a number of waivers. So you'll see that from July 1st, 2023 there's an initial 2% increase, and then specific rates have seen increases with respect to what kind of primary services are offered with that as well. You can find that at the link provided for provider rates and the fee schedules. Now, the department also approved an increase in the base wage to $17 per hour. This is going to reflect outside Denver County with a increase in the base wage, or I should say minimum wage, inside Denver County to $18.29 as well. It's going to be cognizant of the differences in cost of living inside the county and then outside the county. Just we want to make sure that we're also trying to keep up with what it takes to be able to have a living wage for the direct care workers. Base wage attestation is going to take a look. It's essentially going to be a little bit different this year because we have more of an advanced or a little bit more of a involved attestation form for 2024. We have more questions like, for example, average hours worked, or average hours that the direct care worker is working, whether or not they have more than one primary service providing more than one primary service, and also where specifically they're working. So which county, Denver and surrounding metropolitan areas, or in areas that might not otherwise be notably served. So we also are able to find where direct care workers are working the most, which are correlated to higher or lower wages, and then where, for example, the mobility might be. Also, we're going to continue the practice of payment withholding. So essentially, when the 2024 attestation form gets released on the 1st of July, providers will have what is essentially 45 days or up until August 30th to provide the data for that is to be in compliance. If they haven't provided anything in that time frame, their funds, either paid by checks or EFT, will be withheld. The reason why we're continuing to do so is because we wanted to make sure that providers know that there is a very real consequence associated with not being able to have this information. But there is also another important aspect where we're very willing to work with providers. For example, if there's difficulty in being able to fill out the form or any kind of confusion, so long as there's a dialogue that's been established, it's been a very fruitful endeavor to be able to work with providers, show that we're really trying to help them understand in case there's any questions or any kind of confusion, and go from there. The clemency with which the people we're working with in the base wage inbox has really helped establish a bridge between the providers and what they know we are capable of in terms of establishing a sense of teamwork and a sense of growth from there. It isn't punitive, but it's meant to show there is live consequences. However, in an effort to work together, more success can grow from there, and it really is it really is a team endeavor from there. But yeah, that's pretty much what we're looking at for HCBS rate and base wage increases. Specifically, once we have this, we're also going to take information from the 2023, or I should say, there's going to be a dashboard that we're going to create that is very similar to the 2022 dashboard, but we're also going to be able to show really in-depth comparisons and also be able to explain any kind of discrepancies or how the direct care workforce has shifted, for example, any increase or decrease in number of direct care workers, number of providers, and of course, the average hourly or per diem wage over the course of the years. Yeah.
Perfect. Thanks, Chaz.
Mm-hmm.
I went ahead and dropped some links in there. So the dashboard that he was talking about is the first link. Also the memo series and the rate schedule in relation to that base wage and the across the board rate increases, that's all in there as well. If you have specific questions for base wage, there is an inbox that's set up for that, which I included, and route all your questions to that. That team is very well versed, like Jazz said, and able to have that conversation and that dialogue back and forth to make sure you get what you need. So are there any questions for Jazz? Perfect. All right. Well, thank you, Jazz. Thanks, John. Thanks, Justin. Thanks for all the updates on the ARPA projects. A lot of this really exciting to see a lot of these kind of come to fruition. I feel like we've been talking about them for years. And so to actually see a lot of it live and in real life is really exciting. So thanks all. Thanks, Deborah, for the legislative review. Let us move into our next update from Carrie.
Hi, everybody. My name is Carrie Chesney. I'm the outreach manager for the Division of Labor Standards and Statistics, specifically the labor standards side, under the Department of Labor and Employment. Many of you probably don't remember me. I don't think I've been at this specific collaborative since October of last year when we were looking for applicants for the Direct Care Workforce Stabilization Board. But I am here today to give you a bit of an update about the Direct Care Workforce Stabilization Board. So as a quick reminder, the board is composed of direct care workers or worker organizations, direct care consumers, direct care employers, and some government workers. And they are intended to come together to develop recommendations for the governor and the legislature at least every 2 years, starting September 1st, 2024, for minimum direct care employment standards to protect and ensure the health and welfare of workers without impeding the dignity and independence of consumers, and also to provide recommendations on how the state can better communicate information to workers about their rights in the obligations of direct care employers. So those are kind of the primary drives of the board. Now, in this first year, they actually have less than a year to develop their recommendations. And so everything's been moving pretty quickly. And so if you could go to the next slide for me, that'd be great. Awesome. So, and what I mean by that is the board is really only has to meet once a quarter, but it's been meeting monthly in part because the board has to make these recommendations pretty quick. So as it says, that deadline is September 1st. And so so currently in process, we have just finished the regional public hearings. So there was a requirement for 4 public hearings to occur at different times of day in different areas of the state, with access to Zoom, so that workers and employers and everyone can access those public hearings. So we did have those: Boulder, Pueblo, Aurora, and then it was in Palisade, but it was meant to encompass the Grand Junction area. So we got a lot of feedback from workers, from employers. And so the board has gathered that information. And so now what they're going to start doing is they're going to start developing those recommendations. So the next couple of months, they are still meeting monthly. And the next couple of months are going to be about developing those recommendations to give to the governor and to the legislature. And again, it has to be completed by September 1st. So that's where we're at with that. You can attend those board meetings. They are open to the public, either via Zoom or in person. Again, our next board meeting is this Friday at our offices, 633 17th Street, 12th floor conference room, or you can attend via Zoom. And we have all of that information on our webpage, cdle.colorado.gov/directcare. If you kind of scroll to the bottom, there's a calendar. That's where you're going to find the Zoom links. Also know that there is a little tabby with a down arrow that has the Direct Care Workforce Stabilization Board information. It has everyone who's on it. It has all of our past transcripts. It has all of our past public hearings. You can find all of that there. So that's all I got for you.
Perfect. Thank you, Carrie. That was an impressive update in just like 3 minutes. I like it.
Awesome. Thank you.
Perfect. I did drop the link for the website in there as well for you to explore as well. Perfect. All right. So normally we would move right into our open forum. Let me actually make sure there's no questions for Carrie before I scoot out of here. All right, looks good. Okay, perfect. So normally we'd move right into our open forum, but I'm really working on getting some updates to our survey. And so I'm going to drop the survey link and the topic request form one more time. So if you have to leave a little early, you still have it. You don't even have to fill it out right now. Just maybe open it on a tab and then you can fill it out when you have time. But really truly trying to get some feedback, not just for HICPUF team, but also for the leadership team to be able to craft future agendas for action groups, for the collaborative. Again, we really want to make sure this is a good use of your time. So please, please, please. All right. So Going to move into our open forum. This is kind of the last big thing we have on our agenda. This is where we really open it up to the floor. We open up to the attendees for different announcements, questions you might have if you have big events happening or resources you want to share. And so at this point, I'm just going to give everybody a chance to collect their thoughts and feel free to come off mute or raise your hand. Allie, please. Yes.
Hi, everyone. So I'm Allison. I'm from Vital Hearts, and I just wanted to take a brief opportunity to let you know about Vital Hearts and some exciting news for direct care workers. Vital Hearts provides secondary trauma resiliency training for several fields, including healthcare, victim services, the FBI, and now we've added direct care workers. Please check us out at our website at vitalhearts.org to learn more about us. So last year we received a grant and we designed a customized training that is specific to direct care workers with tremendous success. This training is for direct care workers that are overwhelmed, burned out, they're suffering from, compassion fatigue from the stress that they take on. We received a grant this year again, and we have a few dates that are scheduled. I'd like to share them with you. And please, if you would like to distribute this information with agencies and contacts that you may know. Both dates that we have scheduled right now are one-day online trainings, and this is to allow for flexibility for both the direct care worker themselves as well as their agency. We have full scholarships to offer, and we also provide work compensation in the amount of $200 per direct care worker that does complete our training. And this work compensation can be used at their supervisor's discretion. So perhaps a supervisor might say they're going to give $100 towards the direct care worker if they didn't have a PTO day to use to attend our training, and maybe the other half would go to finding coverage for that direct care worker. I'm going to place the digital flyer into the chat. Please just take a moment to open the chat and click on that flyer and save it. Again, we would appreciate everyone to distribute that, spread the word for us. We did have a June training that was set for this Monday. However, we had to cancel it due to lack of registrations. So we also did we have an extra person that is helping us out for this grant only, and she is kind of localized in person, and she's doing some outreach for us as well. But again, if you could help spread the word, it's a great opportunity, and we really want to be able to offer this to the direct care workers before the grant expires in August. Okay. And that's it for me, and I appreciate your time.
Yes, thank you, Allison.
Thank you.
And there
so
is
much.
a comment in the chat too for you. That's Ann Patton says she's taken a Vital Hearts training in the past, and it's a great resource to take advantage of. She highly recommends it. So
very good. Thank you so much. I appreciate that feedback. Okay,
yeah.
wonderful.
Thank you. So if you were on the fence about clicking on the link and attending one of the trainings, Ann should have just made your decision really easy. Lisa, I have you that would like to speak. iPhone 2.
Yeah, hi, thank you. Yeah, my name's Lisa Dukevich, and I first of all I wanted to say this is always so helpful to listen in to all these conversations, and also to I think that the what Vital Hearts has come up with is really, really great. That's kind of like a hidden thing there where it's just super, super important. And I think that's awesome. I didn't even realize something like that was out there. So I'll be sure and spread the word on that. But then the other thing I just was going to mention is that so myself, along with 6 other people, we formed just a small nonprofit called the Colorado Paralysis Foundation. And it's headed up by Evie Force, who's a cervical 4 complete spinal injury. And there's actually we have others. We actually have 4 others that are also injuries in that group. A lot of OTs. We recently brought on an attorney, and we have a CPA. So we're very small, just a little group. But the whole reason behind what our purpose is training people at this point, caregivers specific to SCI initially, and it's probably going to going to spread from there, but at this point it's SEI, and we're working with Craig Hospital to teach on site, to teach those caregivers, and then to eventually receive a certificate. And then we also plan to, we'll be having fundraisers eventually, and eventually also be able to provide grants for, possibly the Peak Center or miscellaneous. We're just now talking about that, and also possibly even having a module in and around some ethics, because in the meeting that we had last Saturday at Craig Hospital, the other individuals that have spinal cord injury on our little foundation deal sometimes with abandonment, and people that might not show up at the last minute, and just a lot of situations where it leaves somebody with the spinal cord injury in crisis. And so maybe just talking in and around how we can reduce that, and not only reduce it for the people with spinal cord injury, but also reduce it for the caregiver, because most caregivers aren't going to walk out or not show up if things are going fine. So usually there's something behind that. So, and I just wanted to say, lastly, maybe eventually, we might be a fit for the directcarecareers.com site. We could possibly be a link that somebody might go to wanting to have training specific to SCI care. So, all right, thank you. That's what I wanted to pass on.
Thank you, Lisa.
Thank you.
Lisa, there's a request in the chat if we can get your email or contact if people are interested in learning more about the work you're doing.
Yes, absolutely. And I'll let me put that in the chat. Thank you.
Okay. Yeah, thanks, Lisa. Do we have any other folks who'd like to speak for our open forum? I have one announcement from Dr. Judy Scott, who wasn't able to join us today. If you have been around very long, you know that Judy and her team at UCCS has been instrumental in the Colorado Direct Care Training Program in developing that and those training modules. And she wasn't able to be here today, but she wanted me to share just a quick message kind of as that project wraps up. And so she just wants everyone to know that they're so grateful for all the contributions of the collaborative members and the training and career advancement group to make this curriculum a robust and useful resource. While the 32 module curriculum is complete for now in English and Spanish, she knows that there'll be updates and revisions in the future. Watch your inbox, watch these meetings, watch this website for the go live date on Direct Care Careers as that goes live for launch, and continue to attend those training and career advancement action group meetings and this meeting for updates and how to continue to be a part of that. So we're super excited for that. I'm assuming we'll send out a big email when it goes live if it doesn't line up with the meeting. But yeah, just keep tabs on us for updates on CDCT. And thank you from Judy and team, I would say. All right. Any other announcements?
I could say one other quick thing. This is Lisa.
Sure. Yeah, sure, Lisa.
I just wanted to also mention, with regards to our little foundation, the Colorado Paralysis Foundation, that we're going to be deemed an independent affiliate of the Christopher Reeve Foundation, and Colorado or Denver will be the first affiliate ever. So I also wanted to mention that kind of as a side note. Our president has spoken at the Reeve Foundation and is actively involved on that side. So anyway, I just wanted to mention that also.
Great. Thank you, Lisa. That's a great update. It's exciting. And I know there's a lot of folks here in this group and probably the action groups that are interested in that work. Lisa, do you all have a website?
And actually I can mention that too. We do not. So the website was just provided to all of the board members on Saturday. So now we're fine tuning it. We have not made an official announcement, but what I could do is I could keep you up to date when that does go live.
Please, that would be great. I think that'd be a great resource, and I can update the slides for this with that information as well, because there does seem to be quite a bit of interest for it. So
thank you. Thanks so much.
yeah, thanks, Lisa. All right. Well, I think I'll go ahead and move us into the last few minutes of our meeting here. So our next collaborative meeting will be Wednesday, September 11th, same time, same place. Information about that, again, can be found on our website, which I'll drop one more time for us in here. If you have any thoughts in the meantime, you want to get a hold of us, you're welcome to email us at the website there. Get in touch with us about specific topics or things you might have. You can also use the topic request form or provide that on the survey feedback as well. But any avenue for feedback, I will take it. So use it how you wish. I'm going to drop a bunch of resources in the chat as well, just for the things we share all the time, the surveys, the different grants that are open and soliciting right now, the website. These will all be in the notes though, so don't feel like you have to save them all right now. We just like to drop them at the end for you. I'll get those going. Any parting thoughts before we leave? Thank you to those of you who stuck with us through the end. I know an hour and a half can sometimes be hard to find in the middle of your day, but we really appreciate it. And yeah, any final thoughts? Perfect. Well, thank you all so much. Reach out to us if you need anything. Oh, Bobby, please. Yes.
I just wanted to say thank you, Brooke, for working so hard and keeping us all together.
Thank you, Bobby. Appreciate you so much. All right, thanks all. We'll see you next time. We hope to see you in July for some action group meetings. But if not, we'll see you in September. Have a great summer. Be safe. We'll talk to you soon. Thank you.
Thank you.